Okay, these are voice recordings made with Dr. Chetana Kripalu. So the question here is regarding desire. You just talked about the heart math program, thoughts and emotions, and the various loops that people are stuck in. To actually be consistent in doing any meditation practice, whether it's a very initial one or even a more advanced one, it requires some level of motivation, some level of desire, personal responsibility, the things that we've talked about before. Could you say more about what is desire actually and motivation in the context of meditation and overall health? See where that goes. I was just trying to pick your brain a little bit here.
No, that's fine. So, in context of health?
In context of health, because we're trying to link meditation with good mental health and physical health, right?
Yeah.
So what is the role of desire?
Got it.
And I'm just using that word. You may use a different word if you want.
So this is very important, desire. So how do you create desire? You look at people, and all the people are stuck in different modes or different points or states. Some of them are really sick and they don't know how to get out of it.
Yeah.
Some of them are sick and because I'm talking more in spectrum I see, so it will be easier for me to kind of start from there.
Yes.
There are people who are very motivated to change their health, and so obviously it's easier to advise and give them a direction. And then there's some people who have just no motivation at all, and they're very comfortable and not comfortable, but just okay where they are, and they don't have desire to move on, to be better.
Yes.
And this doesn't have to be only in health; it could be in anything.
In so many things.
But that's, I would say, that's the state of evolution every single human being is in. So how to create a desire, that is tough. It has to come from within. It is not easy to create a desire. However, one thing what we are trying to do and we want to do is to create awareness. So the point is, some of them maybe they do not have a desire to improve their health because they see around them whatever they see around them, and they think that is the natural state. And so they may not know there is another way around it.
Sure.
So that's the awareness we're talking about. So to go out there and say that there are better ways of living,
Sure,
to enjoy and experience even more of life. And so it's not just health, it's more of life.
It's overall, yes.
Right? So nobody can deny that they want to feel energetic, they want to be, feel wonderful all the time, calm all the time, excited all the
Balanced.
time, and, just be balanced, or however you want to, talk about it. But the fact is, people don't know how to feel that, how to be in that state, or how to even get to that state. So there's several factors to that, to get to that state. So human being in general, in general, human, not just human body, we are beings who have several aspects to us. So it is not just one thing which fulfills us and say, okay, you're going to be happy, but there is so many parts of it which needs nurturing. So I think for one to really, it's again, you have to go in deep and go inwards for each person to figure out what is it that I really want. And it doesn't have to be for life, even short-term goals, whether it's a month or 2 months, because lifetime goal, it may not come to you that easily, but you have to have a lot of, again, a certain state of evolution where you have clarity and everything mentally, and we're not there yet. So but even to get to, like, for example, in a month, you have your child's graduation, or you have a vacation coming up, or you have a wedding coming up, you want to tone up, you want to do something. You just have to have something like that so you can start somewhere. Because what I've seen is, and this is, it's very, if you don't have the desire, it's very difficult to move forward. So it's kind of like a necessity almost to get to any point.
So, everything that you just said, I certainly think that is right on point. But we kind of back up just a moment. We talked about awareness. You mentioned the word awareness, and I asked you the question about desire. We've all heard this word awareness over and over again. Most patients have, most people have heard about this. To be aware is a certain kind of state to be in, right? So if you could maybe elaborate on that, and in your elaboration on being aware, or what that is, however you want to talk about this, up to you. What is the relationship with desire? Is it the same thing, or is it different somehow, or one comes first, one comes second? What is, just kind of see if you can maybe elaborate on that a little bit more.
Yeah, so the first step is awareness, which I have seen, because to be aware is very simple if you really look at it. In the way I feel awareness is just paying attention, just observing. And what I mean by that is most of the time we're not observant at all. And what I mean by that is we're all drowning in our thought processes, meaning we're either in the past thinking about something or something that happened and dwelling upon it, making thought loops of it, or in the future. For example, if you're driving, that would be the perfect example to say that, are we driving, paying attention to the road, the things which are going around? I think most of us don't do that. We don't know how we got from point A to point B, especially if you're going to work and back and forth.
Yes.
Before we know it, we got home and we don't realize how we did it, because we're deep in thought, this thought loop which goes from one to the other. And that's what interrupts our being aware. So it's that simple. If you really go, just be in the moment, in the present moment, mindful of what you are doing, and just pay attention is called awareness. Now, again, that is just the definition, just the simple definition of awareness. That comes in every level. So when you're aware of, let's say you're eating your food, you want to be really focusing on what you're eating, how it stimulates your senses, how much you're eating, how much is your stomach telling to eat. These are all just being present, paying attention to that moment in time. That's what awareness means.
Right. Okay. So let's say I'm trying to do that. Just take the eating example, right? So let's say I have couple of delicious dishes and I want to eat meditatively, or I want to eat with awareness. But let's say that I'm trying to control my sugar levels, I'm trying to control my diet, I'm trying to not eat too much, this kind of thing. When I start eating, and if I like what I eat, I want to eat more of that. And there is this tendency to eat much more than what the body needs. This is just an example, and we can apply this to other areas. How is one to infuse meditation in such a way so that one doesn't wind up eating too much? And I'm just using this as an example. I mean, this could be thinking too much about a particular problem, or gambling too much, or taking alcohol too much, or it could be anything that is in excess that is actually causing harm. It could be worrying about some conflict of the past, or it could be a trauma from the past. It could be any of those things that we feed upon. So what is the way that meditation is infused in making that separation? Because I'm having a meal, as an example, or if I go to a buffet that has 100 items, well, and I'm really hungry, so there's a tendency to eat a lot of higher quantity, including the sweets bar and all, and all that kind of stuff, because we're trying to get to a certain type of experience. So how does one differentiate, between harmful activity versus really beneficial activity without damaging desire or pleasure, and having a fulfilling aspect? I think you see what I'm saying here. So just take your time.
Yeah, that's okay. So a couple of things you can do is, first thing is, you don't want to to go to any meal being so hungry that you would eat anything. So that's number one.
Okay.
So for that, obviously you have to make sure that you're eating when you're hungry, not to the point when you're famished. So that is number one.
That's a very important point. Would you repeat that again, please?
Right. So you're going to eat when you're just hungry. But that instead of waiting till you're so hungry and famished that you would eat anything and everything.
Yes.
Meaning, in medical terms, there's a difference, because when you're hungry, your body is just trying to say, oh, okay, you can eat something. When you're famished,
Yes.
your blood sugar levels are completely low. So at that point, because your blood sugar are low, your body needs that sugar. Your mind is not in its right mind.
Right.
The best thing to put it. So it's not going to make a good decision at that point. So you really have to. That's why I see, again, this is intuitive eating we're talking about. It comes with with time. It comes with, again, awareness about your body, what it needs, and when it needs what. Couple of things to do before meal is half hour before meal, a big tall glass of water, because a lot of times we cannot differentiate between hunger and thirst. So you want to know that you're giving your enough hydration so that you are not eating when you're supposed to drink water.
So that's a very, very important distinction, being able to differentiate between hunger and thirst, which most people don't even think about.
And that's where the awareness comes. So the awareness of your body and awareness of where your mind are going, where your thoughts are going. So that is number one. Even if we build that awareness all the time, we know what to do. And that's why you don't need anybody telling you or giving you a whole menu card or this and that and everything. So really, we are built in ourselves. Your body tells you, but we are not willing to listen at every point what it needs. Not what you want with your mind, but what the body needs. So I think that's the distinction one comes with being more aware. So another pointer for the eating part is that water is one thing, and that's why you want to eat meditatively. What it means is you're not watching TV, you're not talking too much with somebody when you don't know what you're eating, or you're not looking at your computer, you're not looking at your phone, eating so fast that you don't know what you're eating and you just can't tell how much you're eating. So that is very important. Even if you have 10 minutes, you really want to calm yourself down. So take deep breaths before you even eat. Do this technique which we always talk about, like whether heart focus, just a 2-minute or even like a 30-second or 1-minute meditation where you're really grateful and even almost like self-talk to your body, saying that, thank you for this wonderful meal, and everything is going to be nutritious, everything you eat is going to be good for you, and start eating. And then pay attention when you are about 80% full, and not to eat completely till you're really overfull, because you can always eat again. And this is actually a little bit on a different note.
Sure.
Most people have this insecurity that, oh my God, if I don't get another meal, I'm going to die.
Right.
And that's something which you have to work on. That's a whole different topic.
Sure.
But you want to eat enough that you're not overfull, because then you'll have problems with digestion and everything. And once you do that, you just walk away from there. You don't give yourself time to make, playing with your mind. Should I stop? Should I eat more? That kind of stuff. So you walk away, and invariably the food settles and you actually don't feel hungry enough to eat more. And then you drink water maybe 15 minutes after, so that you have a proper digestion and later absorption and everything.
So this is a great example of the relationship between awareness and desire, which we can all relate to, because we all eat every day. We all need food, obviously. So okay, very good. So that's very good, and we'll be asking some more follow-ups on this a little bit later. Thank you very much, Dr. Chetana.